Hello. Today I will be reading from the Santa Barbara County Mental Health Plan Member Services Beneficiary Brochure. So first I'm going to start by explaining about some of the services that are offered by the Santa Barbara County Mental Health Plan. So what services are available? Firstly, we offer outreach services to assist in connecting our beneficiaries with needed mental health services. In addition, we offer psychiatric inpatient hospitalization. This is 24-hour intensive inpatient psychiatric treatment. We offer assessment and evaluations. So these are telephone screenings that are performed by licensed clinicians, followed by an assessment at the appropriate treatment site. We offer individual, family, and group therapy. So following the assessment done by our access team, you can receive individual, family, or group therapy provided by either private providers or county clinics. We do medication evaluation and treatment services. So again, following the assessment by the access team, medication evaluation and treatment may be provided by private providers, county clinics, or referral to community primary care providers. We offer crisis and emergency services. In a crisis situation, you can call either 911 if there's immediate danger involved, or the mobile crisis team. And the number for the mobile crisis team is 888-866-1649. Beneficiaries who receive services from a county clinic are assigned a case manager who will be a primary contact person and will assist with meeting goals and coordinating needs. We also offer rehabilitation services, so activities designated to help you develop your social, financial, recreational, vocational, and life skills. We also offer residential services. So these are mental health services provided in a 24-hour residential setting for long-term and transitional living. We offer therapeutic behavioral services. So this is short-term, one-on-one intensive behavioral support as part of a comprehensive plan of care. We offer supported housing, so services providing a higher level of mental health care and treatment. And we have assertive community treatment, or ACT, which is the highest level of care to beneficiaries with serious mental illness. So how can you obtain your member services? If you are seeking specialty mental health care for yourself or someone else who is experiencing mental illness or emotional problems, call the access team. It's a toll-free number, and the number is 1-888-868-1649. A licensed clinician on the access team will complete an evaluation and make appropriate referral for you to receive necessary services. You have a right to a list of available providers, agencies, and their specialties, which include alternatives and options for cultural and linguistic services. So you have a right to receive services in your native language. To obtain this list, call the access team number 1-888-868-1649, or you can call Beneficiary Concerns. The number for Beneficiary Concerns is 805-681-4777. Linguistic services are provided at no cost to you, and all services except those provided in an emergency setting require pre-authorization through the access team. Medi-Cal beneficiaries and non-insured clients will not be charged for psychiatric emergency services that include psychiatric hospitalization. However, the Department of Behavioral Wellness is not responsible for any other costs incurred, such as non-psychiatric hospital charges, lab work, and AMR transportation to the hospital. What if you have a psychiatric emergency? In the case of psychiatric emergency involving the possibility of immediate danger, please call 911. Otherwise, you may contact Mobile Crisis Team at 1-888-868-1649. All services are confidential. Confidentiality of mental health information is maintained pursuant to all applicable state and federal laws and regulations. If you are not satisfied with your therapist or clinic, you are encouraged to discuss this with the clinical staff and program supervisor. Should you wish to change clinic or therapists, simply complete a change of clinician form and submit it to the program supervisor. Requests for a change of clinician are routinely accommodated and are not considered grievances. Changes of clinician forms are found in the waiting room of each behavioral wellness outpatient clinic. You may also obtain this form by calling Beneficiary Concerns at 1-805-681-4777. If your request is denied, you have a right to appeal a treatment team's decision. Appeal forms are also available in the waiting rooms of our clinics or by calling Beneficiary Concerns. What if you have a grievance? If you have a problem with services, you may verbally or in writing make a grievance without experiencing any penalty, discrimination, sanction, or restriction. You are encouraged to discuss issues regarding mental health services directly with the clinician, case manager, doctor, or the clinic supervisor or manager. Most problems can be resolved by talking directly on an informal basis with people who are involved or who might be able to help. If this is not satisfactory, you have a right to file an official grievance by contacting Beneficiary Concerns at this phone number, 805-681-4777. Or you can find a grievance form in the waiting room of the outpatient clinic. Provider network clients may direct their grievances directly to Beneficiary Concerns at the number I just gave you. So, is there a cost? This is a little bit technical, so please listen carefully. These services are covered by your Medi-Cal benefit except where limited by aid code restriction. If you have a share of cost or SOC Medi-Cal, you are responsible for the monthly SOC amount. If you have any questions regarding your Medi-Cal status, please contact your eligibility worker. If you are uninsured and your mental health screening indicates that you are eligible for services, personal financial information will be obtained by a method developed by the State of California Department of Mental Health. This method is called Uniformed Method for Determining Ability to Pay, or UMDAP. The result of this process determines what your personal financial obligation is when you receive services. A patient representative is available to assist you in understanding and completing this process. You will be provided with written information regarding your obligation to pay for services. You can always request a second opinion. You may request a second opinion on the need for specialty mental health services by completing the request for second opinion form available at each treatment site or by calling 805-681-4777. If you need assistance with a grievance, appeal, change of clinician form, advance directive, or state fair hearing, you may request a help from Beneficiary Concerns at 805-681-4777. Or you can talk to a patient rights advocate. The phone numbers for patient rights advocates are 805-681-4735 or 805-934-6548. So this concludes our reading from the Santa Barbara County Mental Health Plan Member Services Beneficiary Brochure. You now know a little bit more about the types of services we offer and how you can obtain services. And you know what to do in the case of a psychiatric emergency, or if you want to change your provider or clinician, or what to do in the case of a grievance. So again, just to give you the numbers, the important telephone numbers that you might need one more time, you can contact the Access team toll-free, 24 hours a day, 7 days a week at 1-888-868-1649. The phone number for beneficiary concerns is 805-681-4777. And you may talk to a patient rights advocate by calling 805-681-4735 or 805-934-6548. Thank you very much and wishing you the best of luck.